Welcome to the Complexity Theory Podcast. My name is Zach McCormick, and I am a lawyer, but this is not legal advice. Today, my guests are Heather and Madeline. Both of them are doulas, and we're going to get into what that means and what they do. And I'm very excited to have them on the show. Ladies, thanks for coming out.
Thanks for having us.
Thanks for having us.
Before we get too much further, I know the two of you are your partners in which business, just so we can get that out there for all the viewers.
Yep, so we're partners with InJoyBirth.
In, as in I-N?
Mm-hmm.
Okay.
Yep.
Finding the joy in birth.
Yeah.
All right.
I promise it's there.
What's the website?
InJoyBirth.com.
Perfect.
Pretty easy.
So I'm going to confess my ignorance. I think stupidly made the mistake of saying, oh, doula, that's like a midwife, right? And I don't know if it was you who corrected me or not. Someone
Probably.
did.
Sounds like something I would do.
Yeah. You don't care who you hurt, right? That's what it comes down to, you know.
I'm just direct.
We got to dispel myths.
What does a doula do?
So we cover a lot of different areas. We are, and I want to preface this by saying that you are not the only person who has come to us and not known what we do.
That's the exact statement.
We have the exact same statement, and usually it is from dads who just don't know how this process works, and I don't mean to disparage.
We don't know how a lot
dads,
of things
but
work.
Yeah. But usually women have done a ton of research and found us, and
Yeah, right.
dads are along kind of going like, okay, what is this person going to be
Who are we
doing at
here
my
meeting?
birth? Who are we here meeting? So a doula's role is a little different than the midwife. Midwives are a little bit more medical, so they are there to do the charting, to make sure that there's the mom and baby's well-being are being taken care of. We are there for a whole bunch of different support. So we provide emotional support, we provide educational support, advocacy, we comfort women through labor. We're there with them from the prenatal period through the birth and postpartum, and kind of act as guides towards this journey.
Yeah, I always say it's kind of like a midwife. I'll say that to someone who's really just doesn't know. Less medical, more patient advocacy. And I think that usually flips the switch. They're like, oh, so you're just here for us.
Yeah.
You know, we don't have a bias of you worrying about suing me for our medical license because we're not your medical care providers. We're not giving you medical advice. We're giving you resources. We're giving you information, helping you make your own decisions, and empowering you guys to make your own decisions as well.
So at the risk of sounding rude, I thought that this was a superfluous service, right?
I've heard that before.
Yeah.
And you're going to hear why you probably won't need to smack me in a second, because I came out of that position of ignorance through some firsthand experience, right? So Heather was our doula for my second son, and to put it mildly, Heather, you were phenomenal. I think I said this on the review, wherever it was I was able to say it. I was saying it everywhere because it was completely true. And I'm glad you described it for everyone who hasn't had the benefit of your services. But the difference was night and day. And it seems like you said something early on about not just advocacy, but you said we're there almost from inception, basically, or as close to that as you could be reasonably. And it was the consistency. It was as simple a thing as that because my first son was born in a hospital, and I think they did a great job for what it's worth, so far as they could. But the approach seemed vastly different. Have you noticed a difference in terms of the folks who, in terms of their comfort, the women who go through a process where a doula is involved versus where it's not?
Absolutely.
Yeah.
In fact, I actually, for my first, I didn't have a doula. And hired one for my second. I hired Heather for my second, so I've known her. She's seen all of me.
Isn't it funny how parenting causes your concern and aversion to just like the human body to just
kind of
totally
fades away.
fall away?
Yep. When you are wiping butts all day, it really doesn't matter anymore.
Yeah.
Although it does matter with my own.
It's just amazing that transition from not having children to children and not having children. I don't think any of us would have said a fraction of the words we just said.
Nope.
And then now we're just like, it's just how it is.
That's just what you do. Yeah.
And you guys see it far more than
We see a
some.
lot.
Yeah.
We see a lot. And I can speak from my own personal experience that having a doula guide me, I had great support in the hospital, but it is that continuity of care So for my first, I think I had 4 different nurses come and go, and the doctor popped in when the doctor popped in, and I didn't know who was going to help me next. And
So that's it.
Yeah.
I want to ask you, because you had that kind of before and after, and obviously I'm not the one in it. So as a mother who's gone through this, what was the thing that caused the different nurses and the doctor just popping in and out? Why was that a bad thing for you?
For me, first of all, it just highlighted the fact that it was a very long process. And I think in the time I was anxious. Additionally, becoming kind of bonded with one of the nurses and then seeing them go without having to actually have them witness my birth was hard. I think them knowing what I've gone through all day, having to re-explain every step of the way that I've gone through, or hearing nurses will meet at changes of shift and kind of go over what's happened. And I felt like a lot of this was kind of happening to me and around me, but I wasn't participating in the conversation.
So it would almost be like someone talking past you, like about you, but talking
saying
past
patient
you.
did this, we gave her this medicine at this o'clock, and I was sitting in the bed going like, hello, here I am. I'd like to have a say in this. And so kind of a night and day difference, having somebody who was there with me the whole time, who knew what I was going through, knew my choices prenatally going into this, because I did have a say. We meet with our clients prenatally and talk about birth plans, talk about what they'd like to do, go over a whole medical history so that we understand what could come up in labor. And just having somebody there by my side the whole time made a big difference.
In that vein, if I can add something.
Yeah.
I mean, if you're going to interrupt, that's fine, I guess.
Interrupt me.
Right.
She was done. It's in the same
We
vein
love
of your
each other.
initial question. Is one of the things I noticed during COVID was I would be on FaceTime because doulas were locked out for a hot minute at certain hospitals in town, for some for a few months and weeks, some for almost the whole year. And so we spent some time on FaceTime with clients in the hospital. Most people left the hospital system, but so one story sticks out to me is we have a doctor we work with, and he was at this birth that day, and he's great. Like, I love him. There's a photo of him on Instagram on our page of him like holding up a placenta and like, look how cool this is. Great doctor.
Talk about that desensitization.
we think these things are cool.
He's a great guy.
Doula humor.
I know. Well,
Gross.
he was great. But there was this birth, and I realized in this moment, a doula's presence is also playing bouncer to certain behaviors. And he came in the room. I'm on FaceTime and a phone, far away. And I hear him come in giving all this really bad, like, trashing their birth plan. Why would you want to do delayed cord clamping? Who said that's valid? I'm like, well, I just let him ramble because I'm about to interrupt him. And I was just listening because I wanted to hear, like, is this really how you treat people who don't have support in the room, who know better, to re-educate them? And I instantly was like, actually, again, American Academy of Pediatrics, World Health Organization, and ACOG, well, I went on a little, like, data rant, and he was like, okay, you're good. See, when it's time to push. He just backed off. And I realized, like, our presence sometimes is all that's really needed to help be an advocate in the room. Mm-hmm. And I mean, it took me, that was 10 years into me practicing as an active doula to discover that.
Wow. Did you have a doula with your children?
Nope. And there's a reason I do what I do. I wish I had, but I had my kids a little bit younger. And, at the time, my husband didn't want to spend the money. And it just didn't seem feasible. Wish I had.
Your services were easily some of the best money that we've ever spent, and we would have paid many times over. And that's not just smoke, folks. This is a sincere review.
That's very thoughtful.
It's true, Madeline, because you've had kind of the both, and again, just from the mother's perspective, with what Heather was saying about the advocacy.
Yeah.
As a father, right, these are emotions that we just don't have. Obviously invested. But I guess the question would be, just having the doula in the room, it sounds like it gave you the comfort, even though you'd already had, one child before, so you had some measure of familiarity with the functionality, the biology, and all what to expect. It sounds like just having the doula there, having Heather there, was one little drop less of anxiety.
Yes, I would say that. And I think it was that way for my husband as well.
Because he knew you were in good hands, basically.
He knew I was in good hands. And, my husband is wonderful and very hands-on, but he went
Get that
through...
in writing for him?
Yeah.
Because it's so rare for husbands to get that kind of review.
He knows.
We're going to get that in writing.
I couldn't do what I do without him. And I'm being serious because I leave and I'll say, I'll see you in either 2 hours or 2 days. And he's got my kids. But I initially thought, my first labor was very long. A lot of first-time moms have longer labors. It was an induction. I didn't quite know what I was doing. And I remember at one point him being so tired, and he went out and he got dinner, and he got a beer with dinner, and he came back. And I was angry, but I was mostly jealous that he got to have a beer and I didn't. And I thought, if I'm going to do this again, it would be just him and I. My parents were with me for my first. And I initially thought I needed somebody to help support him to support me. I wanted to make sure that there was not just one person in the room responsible for making all the decisions, because I feel like for a lot of dads, a lot of this decision making comes down to them. Mom is laboring away and they'll come in and say, all right, baby's heart rate's dropping. We got to do this. And there's no room for a dad to say, oh, hold on. What about offering this instead? It's not what every dad is or every birth partner is educated in what needs to go on. And so I think that was my initial kind of want. And then I also just wanted to make sure I had somebody who could hold me accountable to my birth plan and hold my providers accountable as well.
Oh, that's interesting.
So
keeping me
on to, because yes.
We don't think of it in those terms. I mean, the idea is whatever you want. I mean, you're in the hot seat.
Some moms want that.
Yeah.
Some moms are like, no, you can't let me do this. I'm like,
Really?
in the moment, I can't tell you no.
And
but we have our tricks.
I was open-minded to some things, but I have a little bit more of a bullish doctor. Love my doctor, but she's a little bit more bullish, and I wanted to be able to have the confidence to speak my mind and to have somebody there who could allow me to do so.
So it's not to oversimplify it, but it really does come down in many ways to the comfort that comes with having the numbers on your side.
Yep. I think we're there. We get hired for all different reasons, but I think that advocacy piece, especially in a hospital setting, really makes the difference. In birth centers, there's still some advocacy that can be done, but where their local birth centers are just wonderful places. Home births are wonderful and magical, but they don't always go as planned, and mom might have to go to a hospital. And having somebody to go with them who can say, all right, we've just come from X many hours of labor at home, and now we're in this hospital setting, and mom might be a little bit shocked, and dad might be a little bit shocked, and you've got somebody with them along for the journey.
Yeah, sometimes it's about micromanaging the staff, but in a good way, right? We believe you attract more flies with honey than vinegar. So sometimes it's maybe her medical records are incomplete, and we've got pieces of the pie that they need to make sure she's safe and baby's safe, and we can work collaboratively with them. We work in the hospital more often than not.
Yeah.
I think it's...
Is it tough?
It can be.
We both had our babies in the hospital, so it's also what we know in that context.
What's the attitude like? Are you being treated with respect, or do you find that you're kind of abused?
Well, early on in my career, I was not treated well, and there were times where I was like, I'm just not working at this hospital for a while. I just need a break. But over the years, I think they've either gotten to know me, or the environment has shifted to a more patient-centered and evidence-based way of most providers and nurses practice, especially with the younger generation of doctors and nurses coming in, which has been a nice breath of fresh air. We not only get a nice warm welcome, is we're often referred to by name, like, oh, Heather and Madeline, like, they're great. I have all kinds of stories, but for the most part, it's well received. Especially by nurses who we've actually had a lot of labor and delivery nurse clients over the last few years.
Interesting.
Yeah.
Which is exciting.
Which is wonderful.
Yeah.
And it's always great to walk into a hospital and be greeted by somebody who says, oh, it's you.
Yeah.
We get hugs. And I think it also helps our clients understand that we work well in that environment. You don't want a combative environment while you're giving birth.
That's the question, right?
Yeah.
Because aren't you, if you're an advocate, aren't you?
There's ways.
There's ways. And I think...
Stealth nudging.
We were joking earlier that I was
stories.
Canadian, but that comes in handy. I put on
We're
my...
going to have to censor that part out.
I'm from Canada. But I mean, I joke about that, but my background is actually in customer support and customer support management and in corporate jobs. So I've learned a lot how to kind of...
You know all the code words for saying really bad things to people.
Well, and I think you can deliver it in a nice manner. So we're not walking in there and saying, hey, doc, we don't want you to do this.
Yeah, we're not doctors.
We're not doctors. I didn't get a
Don't
medical
pretend to
degree.
be.
But if I have a client who really is saying, I don't want XYZ, and the doctor's saying, well, I'd like you to do this. Part of my job is to say, hey, you know what? She said she doesn't want this. She's saying no. What other options can we give her? Can we talk about this a little bit more and engage in more of a conversational approach? There's absolutely going to be doctors who kind of walk out there rolling their eyes. But I think even just reminding doctors, hey, or reminding staff, hey, this is a whole person that you're speaking to. Make sure that you're giving them all the options that they need.
Yeah, they have autonomy.
Works.
Let's treat them like that.
I've heard the phrase that medicine treats pregnancy as a condition.
Typically.
Yeah.
What does that mean?
Like pregnancy is a disease that they need to manage to make sure everyone comes out alive on the other end. And are there cases where that is the situation? Of course. Those are not typically the population we see because they know that they need probably a surgical birth in advance. They know they're going to have a baby early. They know they need to be where they need to be. But that's not typically the clients we see. And if it is, we're helping them in a different manner. You know, it's more emotional support and more support for dad. Sometimes, you know, the NICU can be a scary place.
Yeah.
If it's not to be treated as a condition, what should it be treated as then? What's the opposite of that?
It's a natural
physiological
process. Yeah, I mean, this is a little crass, but it's like having a small scale, having a bowel movement, right? Our bodies know how to pass a baby through our bodies and birth them. Women in a coma give birth. You hear stories about that once in a while when they're unconscious and no one even knows they're pregnant.
Wow.
Birth happens. It's a physiological process, just like breathing, digestions, menstrual cycles. These are all natural physiological processes. Birth is part of that. Now, I can understand when you're a doctor and you've seen a million terrible things go wrong, how you'd want to treat it as a condition, but I think there's a great middle ground because it is a natural physiological process.
We're a little bit more risky about it here in Florida because we are very litigious against doctors.
Freaking lawyers.
Yeah, lawyers.
It's the state, really. And it's a 3 strikes you're out rule here for your license for doctors. So they're very protective of it. And
Very cautious.
I can sympathize. I really can. But if you really look at the data and you look at the numbers and the information we have, and if you hear about these crazy stories, you're like, how did we get there? Did that just randomly happen? And that does happen. You hear moms wake up, kind of a mess, stuff happens. But often you hear about these stories. I went in and got induced at 39 weeks because my doctor said that's what they like to do. And I got on this medication and this happened. And
now for the folks that don't know, what's the full term in weeks?
So ACOG, the American College of Obstetrics and Gynecology, say that 38 to 42 weeks is a normal range for a healthy pregnancy. Now, yes, 42 weeks is the latter end
Top
of that.
end, yeah.
But
So that's why when you said, how do we get here? And you said, I was at 39 weeks and my doctor said that's when he likes to.
Yeah, and there's not really adequate data to support that. And we see that a lot with physicians not practicing evidence-based care.
Okay.
And as a doula, I know there's a stigma around what we do. I know that, sometimes we're touted as dirty hippies. And don't get me wrong, I totally have that side of me. I keep it on the down low.
I think I heard Madeline proclaim that she had showered.
I showered today.
Technically, that characterization was accurate up until this morning.
Up until this morning,
Right.
yeah.
Until that annual shower.
Until that, yes.
Right.
I mean, I am Canadian.
Oh,
We
boy.
just thought out.
Oh,
Yeah.
this one's gonna get hate mail. I can already polite hate mail. So this process was fascinating to me because when I saw you in motion, when I saw the midwives and the other women at the birthing center, it was immediately clear to me that I could relax. That as the dad, if I have a function in that capacity, other than trying to lend moral support, it was to try to make sure that I play defense, because she couldn't. Kind of to your point about being an advocate, right? Mm-hmm. But when I was able to observe in that birthing center, I was completely relaxed. I could just see everybody there. They had the touch. Everyone it was the right set of people for that particular job. And it begs the question, how did these people get into that? How did you two decide to become doulas?
You want to go first?
Sure. My story's a little shorter than yours, but...
Did she just call you old?
No. I just had a milestone birthday, so I'm a little
She's
older.
older than me, actually.
A little older. No, I mean, I think for me, I'd always had an interest in women's health and reproductive rights, and it had always been simmering in the kind of background of my mind. And then when I had my first child, and, my birth was fine. It wasn't negative. I didn't come out traumatic, but I definitely didn't feel like it went the way I had thought it was, or should have gone, sorry. And I started talking to my little mom community and realized that there were many women out there who kind of felt like they went through this process and were kicked into a cavern of postpartum without much support, didn't have much support in the birthing process. And so when I had my second and had a doula and realized how powerful that could be, I started thinking about it more seriously. And what it really came down to, honestly, was the pandemic hit. And I was in a corporate job. I had a young baby and a toddler and was working from home and just not happy, and thought I might start exploring this more seriously. And by happenstance, Heather runs a training academy for doulas. And you were running a class right around the same time that I was about to text you to ask about training, and it all just kind of came together.
Wow. So you went from a corporate sort of 9-to-5 kind of job to being at home, and then the children drove you away.
Ironically, it gives her more flexibility.
It gives me way more flexibility. It's hard. I was working from home, but I still could not give my kids all the attention that I felt like they wanted. And, I'd always been a very driven person in my career. I always was going for those management positions, always up for promotions. And I think a lot of people have a similar story during the pandemic. We stopped and reevaluated our priorities. And I thought, this isn't what's making me happy. It's not fulfilling. And while I loved the mega corporation that I worked for, as much as you can love a mega corporation, it wasn't what was going to be carrying me through my life.
That's a pretty profound shift, it sounds like.
It was a major shift, and it's still a little bizarre to not wake up and have a 9-to-5 job. I think it took a little convincing on my husband's end to talk him through this, but he's been my support the entire way. And even
what's
recently,
the point of owning a husband if you can't just tell him?
If I can't tell him exactly what I'm going to do. But even he recently was like, you are a lot happier in what you're doing now. And you can tell. And this is honestly, even at the most exhausting, I came off 2 back-to-back births last week and walked home and threw on pajamas and looked like death. And I just sat on the couch and went, man, how cool was that?
Oh, cool.
Yeah. It's real profound what we do. Yeah.
How about you?
So I actually have a business and marketing background initially, and really liked the idea of working in the corporate world. And I had my kids young, intentionally. I was married young, had them young, and felt very marginalized at the hospital because I was young. I also felt like birth happened to me. They just did the things they did kind of without even informing me they were going in there, which is considered technically obstetrical violence if you look at the definition of that.
Obstetrical violence.
Yeah, it's a long story, but anyway, long story short, I had a lot of issues postpartum. I didn't have a lot of great support at home, unbeknownst to me at the time, and just had a lot of mommy guilt for having a lot of issues with lactation and not really getting very far in that journey. And that I literally let it eat at me so much. I tried to relactate at 14 months postpartum just to you let those wheels spin, they spin somewhere else. And I had someone talk me off a ledge very easily, and I was like, I just need to chill out. So it armed me with information for the next time, and I had this really empowering birth. I literally kicked the doctor away when he told me I couldn't catch my own baby. I was like, the fuck you will. Excuse my language. I don't know if I can swear on here.
I didn't hear a swear word. I think it's fine. Or we'll just be demonetized because of you.
Yep.
Whatever.
Sorry.
One way or the other.
So it was really empowering, and I did have slightly better success last time, but afterwards, but at least I knew more now. And I remember being 3 months postpartum and reading something about doulas and being like, that's what I want to be when I grow up, even though I was already an adult. And it just had this fire in my belly. And
Have
this
you grown
passion. Up? A little bit. It depends who you ask. Well, that's my ex-husband. But I've been doing this for a long time, and I've been a part of almost 1,000 deliveries now.
Wow.
Yeah. And I've
That's
worked
amazing.
at birth centers, and I've worked at, most places in Central Florida, and helped so many different family dynamics. And it's been nothing but empowering. We have terrible hours, but it's allowed me to be a stay-at-home mom which I know sounds crazy because I work so many weird hours, but I only do a handful of births a month, and I get to still be a stay-at-home mom the other times. You know, it's been really helpful, especially now that one of my kids is driving the other one around. It's been, that's been real nice.
But that's a mixed bag right there.
Oh, yeah. We got into his first car accident 83 days after getting his license. So.
But who's counting?
But who's
83?
counting 83.3 days?
Yes.
Yes. And in my car, too. Yeah. Anyway.
As if the guilt that she was using before wasn't powerful enough.
I'm very good at that. But it's nice. It really, I thought I was going to be all about the natural birth and all about the hippy dippy of it all, right? But I feel really charged in the hospital system. I feel like that's really where doulas are needed the most because like you experience like the birth center is a magical place. Honestly, everyone really is there. Like even
the good takes care of itself.
The good, that's a good way to look at it. I like that. But at the hospital, there's a lot of bureaucracy. There's a lot of red tape. And even some of these awesome nurses that we have and work with, their hands are often tied by providers who are like, hey, I'm not willing to wait much longer. I have literally a golf game to get to. We're going to do this or we're going to section her. Like, bring in another physician. Like, there's a lot of doctors. There's hospitalists staffed here. I've literally heard doctors say that in hallways. Our nurses come in and tell us things. So their hands are tied. And so sometimes it's nice to be able to empower my client and say, hey, mama, I know they're putting you on a clock very unnecessarily. Here are our options. You can pick from those options. It's not our job to make decisions on anyone's behalf, but it's definitely empowering being able to help a mom fire her not so great provider and use a hospitalist staff.
They're not out for the best interest.
Yeah.
And unfortunately, doctors tend to be great in the office and not always good in the hospital. Now, that being said, I work with a ton of really wonderful physicians who really do care. But there's a lot of burnout. Obstetrics is a really hard form of medicine to work in. And
is it?
Yeah.
From what I'm told, no, I'm not a doctor.
But
but
I can imagine it's surgical, it's
two
office,
patients at a time you're working with.
Yeah.
Mom
It's a
and
lot.
baby.
Mom and
More
baby.
risk.
And it does, the risk does add up. And I do want to piggyback. We have some wonderful doctors in Central Florida, and I think we work well in the hospital system because we also come to this with a non-judgmental approach for our hospital birthing moms. Every once in a while, we interview moms, and they're like, I looked at a birth center, but I just don't think it's for me. And they almost feel like they have to apologize to us. Or if they're planning an epidural, they'll say, I may try, but I think, like,
We don't care,
girl.
It's your girl to do it.
It's you. It's
Not me.
your journey to get through here. And sometimes these tools are great to prevent trauma or to give you the birth that you want. And if the birth that you want is empowered and without pain, then, hey, I say go for it.
You used that word a few times, empowered.
Yeah.
What does it mean for you in this context?
I think it's making sure that women have the information that they need to make decisions appropriately. Oftentimes, I feel like we are presented with, here is your option. This is the option.
Just say yes to it without
just
questioning.
say yes. And
Told,
I think
not asked.
told, not asked, or not provided with the right information to make an informed decision. So I think empowerment to me in these cases means being able to choose for yourself or to make decisions given the appropriate information. So
it's interesting that's apparently so prevalent because the phrase informed consent is something you see throughout the medical world and frankly the legal world when those two collide.
When the two collide.
But it's interesting that you would see such a lack of that apparently there. I mean, clearly nothing, we're not saying it's done illegally, but the idea, Heather, I think you had said that to make sure all of the options are made clear. Because it sounds like what you're saying is sometimes the case is that there would be sort of someone saying, there's only this one and not saying this one is also here.
Yeah. For instance, sorry, go ahead.
No, please.
I like to use this example. We have a doctor we work with who actually we made the decision recently to stop working with because we just can't deal with the abuse anymore. She requires all of her patients to have an epidural and says, like, I don't know why you wouldn't do that without it. Like, it's crazy. And she leaves it at that and actually, like, makes them.
Wow.
But there's risk to an epidural.
It's an injection into the spinal cord, right?
Yep.
In the dura space.
In the dura space. But anytime you pierce the skin, there's going to be risks.
That's not even the biggest risk. It actually can aggressively lower your blood pressure, which immediately the baby feels in tanks. And then we're back in the OR before we even really got labor off the ground.
Tanks?
Baby's heart rate plummets, which means we're not getting any oxygen or blood to the baby. And that's when we have dangerous outcomes. Wow. That's a risk. And there's
I've literally never heard of that risk.
They don't tell you that.
And those are things that I think
sometimes they sugarcoat it a little bit.
Yeah. I also think it comes down to as simple as saying, so I went in for my induction and they said, we're going to give you this medication and followed by this, followed by this. And what I've learned since is that there may be other options out there. Now, I'm not a doctor, so there may be something in my medical history that's contraindicated for one of them, but I'd like to be told what options there are, what side effects there are, what risks and benefits are, so that I can say, hey, you know what? You're right. That medicine that you recommended to me sounds great to me. I'm going to go ahead with it.
Is it Pitocin? Is that the induction chemical?
There's a bunch.
There's a bunch of
options,
different
but it's
ones.
the main one.
Pitocin is the one that helps make the contractions. And, you know, both of mine ended up being inductions, but the difference was night and day in being told, hey, you're 41 weeks, your baby's measuring big, we're going to get you scheduled in for an induction, versus with my second, I didn't want one, but my stinker of a son would not stay head down. And so I got them to flip him head down and said, like, get him out of me now. I will be induced. But so even though it wasn't my birth preference, I was able to choose that for myself and have a
you
say
made the
in how it
choice.
went. Yes.
You had the say.
I had
She
the
was
say.
empowered to do that.
And I know there are certain situations where we might not have as much of a say as we want. Heather always says, babies don't read our birth plan. And I think it's very
I remember
true.
you saying that. Yep.
It's kind of my
And
motto.
it's
Yeah.
true. Babies, you can have the most
Babies.
magical unicorn
Yeah.
labor, and then baby at the last minute, it's like, meh, I just feel like turning my head a funny way, and I'm going to get stuck.
3-day labor.
That's classic
you
baby.
Classic baby.
Yeah.
They're kind of...
Despite this being so instinctual, they're very irrational creatures.
Yes, they are
Yeah.
very irrational little
Yeah.
buggers.
Yeah, I think my toddler Miles, he was crying the other day because the color of the cup was the non-preferred color, whatever it was.
course.
Sounds like a toddler.
Right. Yeah.
Especially a 2-ish-year-old.
Yes, exactly.
Yeah.
Wait till
Oh,
the
yeah, been
threes.
there. I'm just getting out of the threes for
Are
the
you?
second time. Oh, yeah.
How many do you have?
I have 2 kids.
Two.
One's just finished kindergarten, and I have a almost 4-year-old who has been a 3-nager all year.
Yes, the
Very-
3-nager is a thing.
Yes, it is.
Everyone told us terrible twos with the first.
No,
I didn't
no.
notice that as much. The 3-nager thing was 100% sulky and just
Yeah.
like, I'm like,
Yeah.
whoa, what is this?
Yeah, they are.
He gets that from the mother's side, of course.
Oh,
Always the troublesome.
Listen,
yeah.
always the
I think science tells us that the troublesome genes come from the maternal
Don't
side.
you have some data about this?
Is your mother in the room?
Yeah. Oh.
If I had been mothered better, I probably wouldn't be like this.
I feel like we need a third station here to bring her up.
Yeah.
That's on
Bring her
camera.
on down.
Did you see this? It got thrown. Oh, I didn't know that violence was going to be a part of this
Yeah.
episode, and for like no reason too.
Listen,
You know what I mean?
birth
Like
is
that
a
was,
get
primal.
canceled.
yeah,
This is, yeah.
yeah, that was completely unprovoked.
Birth is a primal process, and it stays with us.
Yeah. Very
Yeah.
much so.
It's interesting you mentioned COVID because it seems like there would have been a lot of people who went through. I mean, it was so life changing in so many ways, but it's for us the reason we came to the birth center, and then of course Heather and. Was because they weren't going to allow me to be in the room with my wife at the time, and I was thinking to myself, "You guys are nuts!
Yeah.
You are nuts!"
I think that's inhumane. Yeah.
I mean, I could understand if they were like, "Listen, you can't have multiple extended family members in there and so forth," but I'm like, "Listen,
Yeah.
both legally and physically, I have a role in this.
Yep.
Lesser, of course, but a role." And that was the moment when we said, "Okay, well, we're looking for an alternative then." And so it sounds like that's a fairly common type of story where we're hearing that people who wouldn't have considered what might previously have been looked at as alternative birthing techniques and protocol had suddenly started to consider not just birthing centers, not just midwives, but then suddenly doulas as well. Have you seen
Yep.
an uptick post-COVID, or is
The
it really
first
not?
2 years of COVID, we saw a lot of that. In fact, I'd say about 2/3 of the population we were serving at the time was like, nope, we're out. Let's go to the birth center. We had a lot more home births than we'd ever had at any time. We saw some interesting things shift from that. Whereas like we would normally see a bunch of long first-time mom births in the hospital. And then these first-time moms, we had 10-hour labors at home or like birth center. So we're seeing a lot faster labors, easier labors, which is shocking to me. I
Interesting.
mean, we know this like innately, right? We know that we're in a safe space. We can
Simple
go
as
do
that.
something. Oxytocin is the hormone, the love hormone, but it's also the chemical compound that physically makes a contraction happen, and it comes from our brain. It's a really shy hormone, and if we don't,
shy?
it's shy. So if you have some adrenaline spiking, it's going to slow down. Often, and not in your wife's case, but often in the car ride, we see labor basically stall. Basically, your wife did all of her laboring in the car.
That's probably my really good driving.
Great driving skills.
Yeah, that's probably
over
what it
all the
was.
bumps that help baby descend.
Yeah. So it can kind of shy away. So it's really common that when we see labor stall out in triage at the hospitals, and it's maybe your contractions aren't as frequently as you thought, which is a little condescending and maybe a little gaslighty. And then as soon as we go home, halfway down the ride, mom's water breaks. We just, it's on, right?
So the adrenaline you're saying is what's causing the mother's body to reduce the oxytocin?
So the stress of it, like the bright lights and the poking and the being questioned while you're in the middle of a full-blown contraction, and maybe being separated from everybody on your team. So some hospitals, even to this day, still make mom go back by herself in triage to get checked. No, to be fair, and I like to show all sides of this, we understand that it's for a domestic violence screening typically, to make sure they feel safe at home and we're not there for a nefarious reason, and the partner's out, the bad guy's out in the lobby. And then someone's allowed back in after that, but it's still it's one person and it's a tiny room and, oh no, there's no rooms upstairs. Sorry, you're down here without your extra support person. We don't even have epidurals down here. The beds are paper thin and bumpy, and things stall out. And it's just this kind of cycle that leaves moms feeling really defeated and then just being like, oh, let's just get an epidural. I can't do any of this any longer once they get upstairs. And whereas we've seen this huge increase of home births and birth center births, now it's tapered out since the world has opened back up. Everything's kind of stabilized with our numbers again. But
is it back? Is it back to the...
Yeah, everyone's doing
we're mostly back in the hospital. And I would say you can see some hospitals have had a shift, and the ones and some that have opened up a little bit sooner, I think, realized the importance of having support people during labor. And I say support people because when it's just you and your partner laboring, again, a lot of that pressure gets put on the support person to make decisions to, if you're laboring for 40 hours, you're not going to sleep for that 40 hours. You want to be awake. So I think it's important to have another person in with you who can tell you, hey, it's a good time to nap. Or why don't you leave? Yeah, we can switch out. The amount of times I tell dads, go get yourself a coffee, or hey, you know what? She has an epidural. It's the middle of the night. We're holding in a good pattern. Go take a nap. And they're like, oh, I can do this.
And we're watching guard.
And we're watching.
Is it, you mentioned, one of you said mom guilt.
Yeah.
I've heard this phrase. And the interesting thing about hearing this from the both of you is I don't have any concept of it. And when I first started to hear about it, I was like, what do you mean you have this voice inside you that's screaming at you and telling you that you're wrong and you're bad and you failed? I don't have that. And I wonder...
societal thing.
Yeah.
I wonder if it's that, or I don't know if it's differences in men and women. I don't know what it is. But is it, when you talk about feeling defeated, it sounds like you're saying that a lot of the women who come in are self-critical.
Yeah. And I think,
go ahead.
I think there's a couple of reasons. I think societally women are always told to kind of be in a certain way. And I think this also goes hand in hand as to how we've been treated at the doctor's office.
You're looking right at me. I can see it. She's saying it without saying it. Men.
Women are the worst
Women
offenders.
are the worst. So I will also say there's a big competitive momming type community out there. And I don't always want to blame woes on social media, because I think social media can be a wonderful, powerful thing. But I think we are so now conditioned to show, like, look at me, I perfectly birthed my baby in the bathtub in 3 hours and I breastfed them perfectly and everything is wonderful.
Keeping up with the Joneses.
There's a lot of that kind of, all right, if you don't breastfeed.
Super toxic in the momming community.
Yeah. If you don't breastfeed, you're not giving your daughter or your child the best start in life. If you don't birth naturally, are you even really birthing? You took an epidural,
do you even birth, bro?
Yeah, and it's basically there are people who believe that C-sections aren't birth, and it's
women gave up and took the easy route.
Took the easy route out, in which I wish they would go through a C-section recovery to see how easy that is.
Hard.
But I think a lot of that mom guilt sometimes comes from the exterior, comparing yourself to what you think a good mother should be.
You create this
Yeah.
image, and if you're not
If you're not
mirroring
that-
it, if you're not achieving
Yep.
that,
Maybe sometimes it's our own expectations. You know,
Yeah.
expectations lead us down the rabbit hole of disappointment. So even if we're like, oh, I'm going to do this and I'm going to do this, and then it doesn't happen, or we change our minds. I don't like to say we disappointed or failed, because you don't think you fail ever, really. You just change your plans. But I think, we just beat each other ourselves up.
Yeah.
I know I did that to myself, and nobody was making me feel that way. I know things. I know that, yes, breast milk is best, and it's, but also you hear things like formula's poison. Like, it's not poison.
It's not poison.
We have
No.
wonderful products on the market if we're able to get it right now.
Yeah.
But
still a shortage.
I don't know.
On and off, I think it's actually gotten a lot better.
Yeah.
And there are a lot more alternative formulas coming out. All right, I don't mean to say
European.
alternative, but European formulas
Good
and stuff that is a little bit more easily digestible. But even then, a fed baby and a supported mom is the best way to do this. As long as mom is supported in the way that she feeds her baby, I'd rather her be able to feed her baby in the way she can, whether that's with fancy European formula, breast milk, or off-the-shelf Costco brand,
Have you found any successful way of combating this mom guilt, this self-deprecation to an extreme?
On a smaller scale for our clients, we really discourage mommy groups. We really tell them to stay off the Google.
Just stay off the internet, basically.
I mean, it's hard, but like if you have a supportive tribe of women, stick with them, because it's like an echo chamber, right? Everyone's kind of got the same values and not concepts, but you know what I mean. If you've got a like-minded group of women and they're all going to support you and love you, that's all you need.
Yeah.
And family.
I think,
Go ahead.
sorry, I was going to say on a small scale, I think it's also just holding space for them to discuss their situation. So oftentimes,
candidly discussing how
Yeah,
they're feeling,
so
as
I
opposed to
think-
being afraid that
Yes.
if they say it, they're going to be branded or
Right.
That's where doulas come in.
ostracized.
We
and that's
really
where
do
we
push
really
that.
do. Yeah. So we do, I think one of the unspoken things that we do a lot of is postpartum support. And for a lot of women, we get discharged from the hospital with your tiny baby and maybe like a pamphlet on breastfeeding, and you're sent home. And
Or how to even care
Or
for
how to
your
even-
own wounds.
yeah,
literally.
Yes.
we're healing. And
Right.
I remember thinking like, oh, I'm fine. I'm just going to go for a walk around the lake in my neighborhood. And halfway around the lake, I realized I couldn't get home. Had to hobble home because nobody was telling me like, you don't have to do this. Just
That's
heal.
damaging to your
Right.
body.
So
No one
I
tells
think
you that
it's-
either.
It's providing a space, and so we'll meet women postpartum and sit with them. And whether it's just unpacking a birth, maybe it didn't go the way they had wanted, or maybe it even did, giving them space to talk about it. Giving them space. I remember telling a mom once that it was okay to give up on breastfeeding. That she had seen lactation consultants and craniosacral therapists and chiropractors and thrown everything at it, and she was exhausted. And it still wasn't quite working out the way she wanted. And I think sometimes just giving them the permission that they need to support their baby and holding their hands through it.
She had
texting them.
convinced herself that if she didn't do this, she was a bad
Yeah,
mother.
and so she would go to appointments every other day with new lactation consultants. We were hooked up to pumps. We were doing all the things. And I don't entirely know why it didn't work out successfully. I don't know the root cause of it. But I remember sitting down with her and having a really frank conversation that involved some tears and some chatting, and then texting her the next day, and she's like, wow, that's all I needed was to talk it through. And her baby is now a year old, healthy, happy. You would never know how he was fed. And she was a lot more relaxed and able to enjoy early motherhood without being strapped to a pump and strapped to appointments. And so I think sometimes it's just providing women that space to unpack their feelings, to bounce things off of a non-biased party, because that is, when you have your mother-in-law or your mother in the room, they may have some biases, or your friends. But
their way.
their
I'm sure
way,
you hear
or,
this a lot. Like,
Yeah.
when I did it,
when
it
I
wasn't
did it,
this way.
my mom said, oh yeah, of course I had you guys, and of course I breastfed you. And then I told her like, yeah, this was back in the 80s. They took me to the nursery for like 6 hours. What do you think they were feeding me in the nursery? Oh yeah, you probably had formula.
Yeah, my
Oh,
mother-in-law
yeah.
said something similar. She's like, I totally breastfed my kids. And then when you really talk to her, she's like, for a couple days,
Yeah,
I think, maybe.
for a couple days. Yeah.
I was like, that's the opposite of what you just told me. And it's
Yeah.
fine. It's been a while, but it's hard because we get those messages as if like it was just easy, you just do it. And then it turns out like you were also thrown into the black hole of what is maternity care.
It's amazing how, even though you guys have kind of come from obviously different places and so forth, the similarity in your stories, like the consistency of the issues that you're seeing. Incidentally, it makes it very clear as to why doulas are a profession, because there is a need. And you've just described from two separate perspectives how consistently these types of issues sort of flare up. And it occurred to me while you were talking about this care that even though, doulas may seem like a new thing, it kind of seems like what you're describing is something that would have been pretty much as ancient as childbirth itself.
Or the Bible talks about women supporting women, like midwives. I think that language is used more, but it's biblical. Like this goes back to the dawn of time.
Right.
Yeah,
women were
have been
supporting women.
each other. I mean, you think back to ancient times too. There were wet nurses, and I know that's not the same thing, but this has always been a community. Birth has been a community, and only in kind of more recent modern times have women become more isolated. We are at
more
home.
Isolated. Oh,
yeah, isolated from community. So we are home.
We don't live in tribes.
Working. We don't live in tribes. We don't live. My parents live miles and miles and miles away. My sister lives miles and miles and miles away. She has birds. She's a different type of person. Love her dearly.
They are close, and you don't want them nearby.
Birds.
Birds. She's a bird mom. But, we don't have that immediate support. And when I had my kids, I was brand new to Florida. I didn't know a soul. And so when I had my daughter and my parents left, I kind of sat there and was like, oh, I don't have anybody to lean on or to rely on. And so I think having a special profession, I guess, or a specific profession to address the issue is addressing a lot of the isolation that women have been feeling in modern times.
We also, if you look at the systems that are in place in the UK, for instance, they have home health nurses that come every 3 days for the first 8 weeks.
Yep.
Part of their medical system. And they just come, they're typically midwives or some sort of trained, probably basically a doula. They come and they help with breastfeeding. They help make sure that your wounds are clean, that you're, able to toilet properly, that the baby's being changed. They're kind of doing, all the things that we're doing, some mental health checking.
It sounds like you're almost like a guide.
Yeah. Sherpa. We've been called a Sherpa a few times.
Sherpas sometimes.
Birth Sherpa.
Birth Sherpa.
Say that
We
10
need that
times.
shirt.
We do. We do need a shirt. Birth Sherpas.
It's fascinating to hear this from the female perspective so articulately and also so candidly, because there is this disconnect, at least in my own experience. Perhaps other fathers have had a greater connection, but it's more the understanding of it. It's more the understanding, the mental state. But it's interesting because then at the same time, what you do is something that from the father's perspective is such an easy sell. If someone had come up to me and said, hey, Zach, your life's going to be so much better if you have a doula because your wife's going to be so much happier. So this is the best thing you can do, because guess what? If it's just you and she's got a question, like, doesn't matter, fill in the blank, whatever it is about this process, I'm on my phone Googling it, hoping I can get the answer. Right.
Yeah.
Exactly. I'm hoping I can get the answer in real time. And I'm pretty good at research because that's part of what I do professionally. But even with that set, that skill set, still there's a lag.
Internet's a crazy place to try and get real information
Yeah.
from.
Plus, you don't know if it's credible, like you're mentioning. So then, when you look at it from the father's perspective, it's interesting because the doula is the birth Sherpa, and basically he just follows along in that train. Then, and that's what you were talking about with it's okay to take a break, and whatever.
But on the flip side of that, I have had many moms call me for that initial phone call to get information and saying, like, my husband feels like your role would just push him out of the way. And he feels really insecure about that. And that's not our job. Or we have dads who are like, I don't feel like, I feel like you would just stick me in the corner and I wouldn't be an active participant. But that's not our job. In fact, one of the visits we do, we asked, the partners, like, well, I put it in sports analogies, coach, assistant coach, tag team, which tends to be more tangible.
Simplifies a little.
Yeah. I've got my analogies.
Right.
Ironically, I have
Big
a lot
shapes,
of sports
colors.
and car and lawnmower analogies for birth. It's the weirdest thing, but they all
Lawnmower?
work.
I haven't
Like
heard
you
your
have to
lawnmower
prime
ones.
a lawnmower. Anyway,
okay.
the context will fit later, but it works. It works. It says sometimes dads are hard to sell. They don't want to spend the money because insurance doesn't cover doulas for the most part. There's some gray area there, but typically they don't see us as legitimate medical professionals, so it's not important to cover. They don't want to spend the money. They feel like we're going to push them out of the way, but really it's just a team effort. And if dad wants
Push
to
them out of the way. That's an
Yeah.
interesting one.
But you know what? Those families that hire us, dads are the first ones to be like, "Oh my God, I really didn't know what I was getting myself into. This was awesome." You know,
Yes.
and the dads, because also when mom's in labor, even if she has an epidural, she's in labor land. She's in that like, you know, she almost looks like she's had a few cocktails, and
I
she's
always
not
joke,
really
and it was-
there.
don't look into this, but my wife found this to be funny, and it was. I always say, well, you know, they gave you a bed and drugs. You know, I had to stand the whole time.
You have to stand the whole time.
Yeah.
Oh.
But don't look into it.
She
But
told me that.
she definitely found it to be very funny. I say that when she's not physically
When she's not
close
physically
enough
close enough to be
to
smacked.
strike
Yeah.
me. Right.
Yeah. But you know, it's our job to make this a good experience for dads and
Yeah.
partners too. You know, we don't ever want anyone to feel like we're pushing them out of the way. This is a team effort for everybody. If they want to be, if not, that's okay too. I would say that's between the two of you
Yep,
guys.
you guys can figure out your roles. But I always think of this as we're birthing a child. It is a family affair. Yes, one participant in the family is doing a lot more of the physical labor.
You're talking about the fathers.
Yes,
Oh, I'm sorry.
I mean
Totally.
standing for that long
Thank
time
you.
is
Finally
a
some
lot.
recognition.
They should offer you some epidurals.
Here's our
but
bumper
where's
sticker.
your- No. But while one of you is going through the laboring experience, there's still roles for both of you, and this is still a beautiful moment as a child enters the world. And we never want to feel like we are usurping that moment from a dad. We want a birthing partner to be there to recognize the birth of their child.
We want to facilitate
We
that
want to
moment.
facilitate. So even if it's just, hey, you know what? I know I've had some partners who are a little bit more queasy. I had one who was so anxious he didn't eat for 3 days, and when it came time to pushing, he stood up and immediately
Dropped.
went right back down. And so I got a chair for him and had him sit up by mom and hold her hand.
And a granola bar.
And a granola bar. Yes, there was some forced
draw.
feeding at that point to up his blood sugar. But it's just, if we can facilitate those moments, I think it helps. And usually by the end, it's dads who are like, oh my gosh, thank you.
Yeah.
High fives.
I had a dad once say, I thought this was a luxury item and that I was privileged to be
Yeah.
able to afford, but really this is a necessity. And
I'll echo that. I'll
Yeah.
echo that completely.
Yeah. But from that, they've had a couple kids. We've used us. And she has a bunch of sisters. We've helped like 10 of their family members since then. And they've even offered to pay for the ones that couldn't afford it. So
that's nice.
yeah, they're like, that's how important it was that they had a doula nearby.
I would agree with that. I mean, it really is. It's funny because the first time I heard the name doula, by the way, where does it come from?
Greek word that means woman who serves. So it's I joke that anytime someone's helpful, I'm like, oh, you're like a this doula, or you know, I'm just a nerdy. It's where my brain goes.
Yeah.
But like I've helped a few friends through divorce, and they're like, you're a divorce doula. I'm like, sure, I like that. I need a shirt for that. But it's just kind of a general term of like a woman who just gives and serves and supports. And in the end, that's our goal, is to do that. Like I don't care where you want to have your baby or how.
Yeah.
I don't do the work. You know.
It was a wonderful realization for me that it went from a luxury to, I would put it in the category of necessity when you look at it from the mental health standpoint for the mother. The difference was palpable. You know, it's the same reason why you would, you know, maybe buy a chair that has more cushion. There's no reason why you should be less comfortable in that setting. And because, you know, in the stress of it, of the events, not just the birth, but especially the birth, where there is zero room to add anxiety. You know, 9 times out of 10 in a given day, you know, you might be able to take a little bit more, you know,
More stress,
Yeah.
more something. Yeah.
but in this setting, there's no margin. You
Yeah.
know, you're at your limits. You feel like you're barely able to function. And so that's why it seems like you get to that point where it's very easy to say it's a necessity.
Yeah.
I really wish that the insurance companies would see it as such, the hospital system would see it as such. Unfortunately, it's for the people who can afford it. And we have a mentorship program that we have to train students. I call my doula babies. Madeline used to be one of them. And I have them doing births for $1,000 cheaper than I am. So we've made it more affordable and attainable for the more marginalized communities, but it's still a cost that not everybody can achieve. So how that will work one day, I don't know, but we're hoping that there's a shift in the medical community that understands the benefits. Like, there's literally data on how we reduce rates of cesarean, which are not, it's not just another way to have birth. There's more risk to it. And yes, risk is relative. Driving a car has risks. We still take that every day. But it's not just immediate risk, it's long-term ramification risk. So it's we're talking like bladder health from when she's in her, when mom's had 3 C-sections and she's having issues in menopause, or mom wants another baby, but she's had a couple of C-sections, and now her rate of maternal fatality is increased by several
really?
100%.
Oh, wow.
Yeah, so this isn't just another way to have a baby. It's not just like, C-section bad, vaginal good. It's literally about health outcomes later in life and in immediate. So I really, the data's there on how doulas lower the risks of things, and moms have
Increase birth outcomes
but
and more positive mental health outcomes afterwards, regardless of how baby comes out. We do help reduce trauma rates and improve mental health rates postpartum.
And that's the part we really haven't talked about that much, right?
Yeah.
The postpartum part, meaning after birth, and it sounds like that's one of the areas where, again, that mom guilt is coming into play. Maybe fear,
sometimes
shock.
it's a mood disorder.
Sometimes there are legitimate mood disorders. I actually had postpartum anxiety, and I didn't even really realize that I did until kind of sat down and went, oh yeah, no, whatever I'm doing right now, I'm lashing out at my husband, checking on the baby way too many times, not sleeping well enough. These were classic signs that I wish that I had somebody to kind of come, and this was with my daughter. With my son, I ended up having a postpartum mood disorder, and
she didn't tell me till like
didn't
a week
tell
ago.
Heather.
True story.
But I actually had better support
Doctor,
structures in
heal
place. I know.
thyself.
It's like, I've got my therapist in place. I've got my stuff. But with my daughter, it was a little bit of, I don't know who to turn to. And I think some of what we do in the postpartum, I call it Rolodex thing because I'm old, but we have that whole network of people, so we can recognize, hey, this is something that you might be experiencing. Here are a couple people we can help work with for that. We're not cure-alls for everything, but I think one of my really close friends was going through a terrible postpartum depression, and her job had a mental health line, so she called it. And she was like, Madeline, I couldn't get through to anybody. They just kind of gave me some pamphlets, and that was their cure. And what she needed was somebody to say, hey, here's a specialized therapist. Here's one that takes insurance. Here's one that doesn't. They both should be accepting new patients. Do you want me to sit with you while you make those calls? Somebody to help really guide through that.
And
because there are recognized mood disorders.
Well, I was just going to say, it's the massive change in hormones that doesn't help things either.
Sometimes it's situational.
Yeah.
It's, for instance, postpartum anxiety is exacerbated by exhaustion.
Yeah.
So if we're on,
makes sense.
If you remember the newborn years.
crazy
Yeah,
mother-in-laws,
that makes sense.
with, not everybody has a good family dynamic at home.
Yeah.
Sometimes we've got family members that are staying far too long with too many opinions, and it's almost adds to the compounding trauma.
Too many opinions. That's very diplomatic of you.
We see a lot of things. Yes. It's just a lot, and 1 in 4 women experience a postpartum mood disorder.
So 25%. I mean, that's huge.
It's huge.
Huge, and we're just literally, oh, you had your baby. We'll see you in 6 weeks.
We see you in 6 to 8 weeks.
Are you wanting to harm you or your baby? No. Yeah. Okay, you're good. Here, see you in a year. That's literally it.
Yeah.
Those.
You get the scrings at the pediatricians. You do a little quiz, and the pediatrician kind of looks it over and check marks it and moves on. And I think it would be wonderful if there's a wider network of understanding of how we can support women postpartum. I thankfully had an amazing pediatrician who recognized a few things and was able to help me resource a few things for myself, because he was just kind and patient and looked at me instead of just looking at the baby.
Which isn't common.
Which
so
is
you
not
just
common.
Got lucky.
Yeah, I did. And honestly, I think there's just there's a big lack of support for
Is there a
postpartum
stigma?
care.
I think that used to be when I was having kids in my teenagers.
Stigma against mental health counseling, or
Well, it just seems like there might be that just get over it kind of mindset.
I think it's more of a work society tells us to be like, we have to be the super mom. We can work and have our babies. And we also have to figure out how to basically do it all, right?
Yeah.
And so if we are needing support, if we need even mental health support, we're failing at that. So that's where I think the stigma comes in for women. Nowadays, it's like a lot of more people are talking about it. Is there still a lot of inadequacy in this situation? Yes, 100%. But we have a wonderful local organization called Central Florida Perinatal Postpartum Alliance, and they do grassroots education.
Not a very easy to say name.
No, it's a mouthful. I think maybe it's not perinatal and postpartum, it's just postpartum. But in my head, I always say perinatal. But
trying to be helpful, right?
Yeah.
If there's someone listening or watching this, are there any, I suppose, local to Central Florida, you just mentioned organizations that they could look for, or in conjunction, are there certain, I guess I'd call it exercises, but like things to do if you think that you're dealing with one of these types of syndromes?
So reaching out for support, finding
Who would that start with, you think?
a licensed mental health counselor.
Okay.
And
There's I can't remember the name right now. The Postpartum Mood Disorders International.
PSI.
PSI.
PSI International.
PSI International is a website that you can go to, or I guess the I stands for international. So PSI. That's like ATM machine. But that's a website you can reach out to, and you can find local mental health counselors through that website. I just went on Psychology Today and filtered through maternal mental health because I knew that was, for me, what I needed.
It's a whole separate certification and training program for that. And it's an investment. So the LMHCs who go through that program, it's a whole lifestyle for them. Like, they're amazing. We have a lot in Central Florida nowadays.
Really?
Yeah, we've got a great community down here.
Seems like Zoom has also helped because now you have sort of this accessibility that may not have been there, or especially if, some folks just want sort of like the immediate access and the confidentiality that kind of comes from just
I think it can be really hard
home.
for a new mom to leave the house. For me, I remember driving was a big anxiety trigger.
Really?
I was new to driving in general.
Well,
when I moved here, I got my license a little bit later in my life. Growing up in a place with wonderful public transportation and then another giant metropolitan area, and then driving in Central Florida with a newborn in the back seat, I was like, oh my goodness.
first time you have to put them in the car seat,
that
you're
was
like,
it. I was like, am I doing this?
Looking
this
at the little
tiny
bubble
little thing.
on the thing.
I know.
trying to-
Oh my goodness. And I was still out of it. So I think even just having access to, you're right, to more accessible care through Zoom. I know that even there are some services online that will offer immediate support. I can't vouch for their services, but I would recommend looking for one that is certified in maternal and perinatal mood disorders, and looking at PSI, or in Central Florida, the Central Florida Postpartum Alliance is a good one.
Yeah. They do more like grassroots education, like in hospitals for pediatricians. It really helped them screen for things better.
And I do have to say, my hospital had a mom support group.
Most
and
do. Yeah.
It was the lifesaver for me in my first experience as a mom. I didn't know anybody. And I remember walking in with a little 3-month-old baby, and I barely was able to get dressed. 3-week-old baby. I was barely able to get dressed. And just to sit in a room with other women and kind of be like, oh my goodness, I'm not alone, was a huge help. And I was able to make connections through there, which was helpful.
Well, kind of rounding things out and back to you both and your business. I think I heard you before we sat down that you said you were off call, right? But that kind of brings up a very interesting point, which is that your services are offered in effect 24/7.
Yes. Literally.
Yep.
Because we never know when the baby's decided it's time.
Usually in the middle of the night.
Yep, usually in the middle of the night and on holidays.
On holidays.
I always joke that whenever Heather goes out of town, everyone decides to have babies.
Yeah. Despite our best efforts to stagger who we
it
take
all
on at that time.
But no, everyone gets support. But yeah, the hours
That's pretty
are
impressive.
interesting.
So I mean, you've got everybody's cell phone number basically.
Yep, you
And
got the whole world.
That's a service that you offer. So again, just to kind of round it out, how would people go about hiring you? How would they find you?
Yeah, so our website is InJoyBirth.com, and you can fill out a contact submission on the website. Our phone number's on there, our email, social media, we're on Instagram.
You want to read out your phone number, and we'll put it in the description if not.
407-330-1433. Does that sound about right?
Question
Don't
mark?
test me.
Question
The
mark?
beauty is I have an office manager now.
Oh.
Actually, she's my
your
business
business
partner.
partner.
She manages all that stuff, so I don't even
see.
remember things like that anymore. But
You're too good for that. You know, for the
We're-
little people. You just
No,
have
it's just-
people
We
for
need
that.
a
I wish.
massive. We need an office goddess to help coordinate all of this. Honestly,
goddess.
I just have ADHD. I really don't have a better
Yep.
excuse.
to coordinate contracts and dates and spreadsheets and help make sure that we're on top of things.
IRS,
And
CPAs.
yes, and getting paid is a massive
Yeah.
undertaking.
Yeah.
So thank you, Alyssa.
We love you, Alyssa.
We love you.
Thanks so much to the both of you for coming on the
Yeah,
show.
it
Really
was lovely.
appreciate
For
it.
having us.
Had a great
Appreciate
time.
it. Thank you.
Us too.